Evita Morin.
Yes, hello. First of all, I wish to thank the committee for the opportunity to access opioid dollars to provide recovery services. This has been critical in our effort to improve the outcomes of our community. My name is Evita Morin. I am the CEO of San Antonio area nonprofit Rise Recovery. We provide middle and high school students across our community with recovery support for substance use disorder. We do this through state-certified peer support teams embedded in schools to engage at-risk youth. Peer support basically means I share my story so that you can change yours. Evidence supports that this is the most effective way to access change behavior in young people. I have to stress, funding treatment is not enough. We ask you for an increase in funding for early intervention and prevention across the continuum of care, most specifically for the peer support model. We are aware that HSSE did not include an exceptional item for recovery in their funding ask this year. Article 3 gave school districts an allotment of $400 million, primarily to secure facilities. And we now need to do more to secure not just our facilities, but the wellness of our young people. We recommend that this funding now address school safety from mental health and substance use disorder issues. This is especially critical in the advent of the fentanyl crisis. Now more than ever, youth are experiencing a much shortened time frame before experimentation becomes accidental overdose. The state must invest in more recovery and early intervention services like peer support in schools before these deadly poisons are completely accessible to all of our children. Thank you for your serious consideration and time dedicated to these efforts.
Thank you, Ms. Morin. Jessie Hinojosa.
Good afternoon, Senators. My name is Jessie Hinojosa. I'm the Director of Operations for the San Antonio nonprofit Rise Recovery. Thank you for allowing me the opportunity to speak to you today about increasing funding for treatment and recovery services during this legislative session. Before working with Rise Recovery, I worked in public school district purchasing for eight years. I made the decision to leave that career because of the impact that Rise Recovery had on my life. Treatment funding for youth in Texas is scarce, and not enough children have access to peer services, which have proven to be effective in reaching at-risk youth struggling with substance use and co-occurring mental health disorders. I am here today to ask you to support an increase in funding for early intervention through the peer support model. Rise Recovery is partially funded through the Youth Recoveries Community Grant, and since HHSC did not include an exceptional item for recovery in their funding ask this year, I am asking that recovery funding remain a focus so that more youth in need can be reached through niche and innovative programs like the one that intervened in my family's lives. Thank you for the work you're already doing on this front.
Thank you.